Well, according to a new survey, 85% of seniors plan to take the COVID-19 vaccine, but they do have plenty of concerns. Joining me now is Richard Ashworth. He is the president and CEO of Tivity Health. Thank you so much for being with us.
Hi, how are you?
I'm doing well, thank you. So, what is worrying seniors when it comes to this vaccine?
Well, there's a couple of concerns, but first I just want to make sure everybody understands what we did is we went through our Silver Sneakers platform, which is a health improvement platform for Medicare beneficiaries. So we help seniors get physically fit and socially connected, getting to a gym or spending time with each other. And so this was important for us because we wanted to understand what are some of these barriers or challenges or anxieties that seniors have as it relates to the vaccine. So good news, 85% of the respondents said they do intend to take the vaccine. However, half of them said they're going to wait a little bit before they take it. When we started to ask, why do you want to wait a little bit? First, there's 15% of seniors who said they don't intend to take it at all. And their number one reason was side effects. They were worried about what the vaccine might do to them whenever they receive it. The second one was around cost. 60% of them said, hey, I'm worried. I'm worried that if I do this, I'm going to have to pay. And even though they're under Medicare, which, as we all know, is going to make the vaccine available at no additional cost.
And why does the potential rollout of COVID-19 vaccine present additional challenges for seniors?
Well, the ones that you would expect, our senior population has a little bit more that they're dealing with on the health front, right? Chronic conditions or maybe lack of transportation. But when we ask them some of these questions, they do have some concerns, like if I take the vaccine, will it give me the virus? In the clinical trial, did the clinical trial have people that are reflective like me in it, right? So they have kind of the normal concerns that you would have. But we all know that this is a higher risk population. So we've asked them to socially distance and physically distance even more, or be even more careful. And so there's some general anxiety around that in our seniors that might make it a little bit more challenging. I think it's also important that people know where to go to get trusted information. I think that's important too.
And we know there's a lot of misinformation out there. So, who can seniors turn to for important and accurate information about this vaccine?
Well, the good news here is I'm a pharmacist by training. So my recommendation of them is exactly how they answered in the survey, because we asked this question. We asked them, where do you go on non-government side to get information about the vaccine? And then we also asked them, where do you go on the government side to get information about the vaccine? And here's what they told us. On the non-government side, I'm going to go to my doctor, my health plan, and my pharmacist. So we were really encouraged by those findings because those are three credible places to go to not only get information about the clinical side of the vaccine, but also the cost side of it. Where can I get it and how much will it be? And under the Medicare, no cost. On the other side, we asked them, where do you go for the government? And they told us the FDA, the CDC, and the NIH. So I couldn't think of a better place to ask this population to go to. And it just shows how experienced and kind of smart they are.
And what is your call to action for seniors?
For seniors, it's ask questions. So make sure you're feeling comfortable. Make sure you ask those questions in credible sources like the ones we just mentioned. And my third call to action is take the vaccine, because we all know the clinical benefits of it. And we're all trying to get back to a sense of normalcy. Just real quick, I asked them, hey, why do you want to take this vaccine at all? And it was for two main reasons. One was to protect themselves. And second was to protect those around them, the people that they love and care about.
And where can people go for more assistance?
Well, I always tell seniors to go directly to your physician or your pharmacist if you want more information. You can also go to Tivity Health, Tivity health.com/vaccine study. And you can go see a lot more information that we got in the study in addition to what I shared with you today.
All right, Richard Ashworth, thank you so much for being with us. Really appreciate it. And we'll be right back with more Midday Maryland right after this. Stay tuned.